Thank you, Mr. Kalra. You're presenting file item 2133. Ready when you are.
Thank you so much, Mr. Chair. Apologies, chairing a committee hearing over in the Capitol building. And I would like to start by thanking committee staff for their work on this bill, and I'll be accepting the committee's amendments. AB 2133 would allow registered veterinary technicians to perform cat neuters under the direct supervision of a veterinarian. California's animal shelters are overwhelmed by a constant onslaught of unwanted cats and dogs. Since COVID, the influx of animals has become so intense that shelters have had to make difficult decisions to euthanize healthy, adoptable animals to make space for new arrivals. Fortunately, spay and neuter surgeries are an effective means of limiting the unchecked pet population. These surgeries sterilize animals, preventing the birth of unwanted litters. However, California does not perform nearly enough spay and neuter surgeries to curb pet overpopulation. The University of Florida estimates that as of 2022, there was a 2.7 million surgery shortfall across the nation. Though many factors contribute to the spay and neuter deficit, data indicates that the ongoing veterinary staffing shortage has significantly impacted surgery availability. The UC Davis Correct Shelter Medicine Program reports that a lack of practicing veterinarians has resulted in more than 40% of California's shelters being unable to provide constant spay and neuter treatments to their animals. Furthermore, the program has shown that 80% of shelters cannot offer low-cost spay and neuter services to their communities. Clearly, there's a pressing need to increase spay and neuter staffing. One way to address this shortfall is to allow RVTs with the necessary training to provide cat neuter services. RVTs are already tasked with many surgery-adjacent responsibilities, including administering anesthesia and dental extractions. AB 2133 recognizes RVT's potential by allowing them to perform cat neuters under the direct supervision of a veterinarian. Committee amendments ensure that this privilege will be paired with robust safeguards. RVTs will be required to complete a training that has been approved by the Veterinary Medical Board, and then will have to be approved by the board before they can begin performing surgery. The bill is limited to cat neuters, as I recognize the increased risk presented to spay surgeries and dog neuters. Due to this risk, these surgeries should be handled by veterinarians. With me to provide supporting testimony are Nancy Ehrlich, California Registered Veterinary Technicians Association, and Dr. Richard Johnson, founder and president of All God's Creatures Teaching Hospital and Surgery Center.
Thank you very much. First witness, 2 minutes apiece, please, and I'll second it.
Hello, Chair and members. My name is Nancy Ehrlich. I'm a registered veterinary technician, and I'm the regulatory legislative advocate for the California Registered Veterinary Technicians Association. California has a pet overpopulation crisis while simultaneously having a shortage of veterinary staff. This bill is one small step toward fixing these linked issues. Right now, there are roughly 8,000 RVTs in the state compared to about 11,000 veterinarians. Why so few RVTs than there are veterinarians? RVTs leave the profession on an average of after 7 years. A big reason for this is that there is very little room for career advancement in the RVT profession. RVTs who have been on the job for many years are restricted to the same tasks that an entry-level RVT is allowed. This bill expands the tasks allowed so that more experienced RVTs may be incentivized to continue their career in the field. It is important to note that only RVTs who have the training and who the veterinarian deems qualified would be neutering cats. I will add that during my lengthy career and 50 years of attending veterinary medical board meetings, I have never observed a case of complications from a routine male cat neuter. This bill will help the veterinary profession by giving RVTs a new lane for career advancement, while also expanding the capacity for sterilization surgeries to help solve the pet overpopulation problem. It is a win-win all around. Thank you for your time.
Thank you very much. Next witness, please, 2 minutes.
Hello, Chair and members of the committee. Thank you for the opportunity to speak. I'm Dr. Richard Johnson, founder and CEO of the Vet Tech Nursing Academy in El Cajon, California. I've taught veterinary technicians for the past 40 years at many different schools across the country. I was on the Veterinary Technician Committee for the Veterinary Medical Board for 9 years and won the CVMA Doctor of the Year Award for my support of veterinary technicians. I am well familiar with the technician's education and abilities. I'm a strong support of AB 2133 for several reasons. First and foremost, veterinary technicians are currently very capable and allowed to do the following. And these are procedures that would be required in a cat neuter situation. Induction of anesthesia. They can create a relief hole in the skin to facilitate catheter placement, which is no different from making a small incision in the scrotum. Suture cutaneous and subcutaneous tissues. While the scrotum is not sutured during the cat neuter procedure, the spermatic cord is ligated and the testicle removed, and the cut end of the spermatic cord can be visualized from any bleeding. It does not retract into the abdomen, and the entire procedure is outside the abdomen. This procedure will require standardized training and certification before the technician will be allowed to perform the procedure. Adding feline castrations to the list of procedures that registered veterinary technicians may perform will make a significant decrease in the pet overpopulation problem that has plagued us for decades. Access to care is decreasing, and in our small survey, local hospitals, the time and wait for a feline castration was anywhere from 2 weeks to 3 months. Increasing the scope of the practice of our registered veterinary technicians will increase their job satisfaction, which will help retain them in the field and decrease compassion fatigue of these extremely valuable team members.
Thank you so much for that. Appreciate that. Anyone else in support? Name and organization to AB 2133.
Hi, Nicholas Sackett for Social Compassion in Legislation, proud sponsors of the bill, in support.
Thank you. Anyone else in support? Seeing none. Anyone in opposition to AB 2133? Come on up, 2 minutes per witness.
Thank you, Mr. Vice Chair. My name is Grant Miller. I'm the Regulatory Director at the California Veterinary Medical Association. I'd like to thank Eddie for working on this bill. Unfortunately, the amendments don't remove the CVMA's strong opposition, but we do appreciate the thinking that went into the amendments. And also, we'd like to thank Assemblymember Kalra. We have a long-standing relationship with him, as well as the sponsors, for engaging us early on the measure. We appreciate the RVT profession and the important contributions that it makes to veterinary medicine, but we feel that it's unacceptably dangerous to try to teach something as advanced as surgery as an on-the-job task, especially in the case like this, where veterinarians actually aren't reporting that we're having problems getting cats neutered. I would like to yield the remainder of my time to Dr. Barbara Filliquist from the UC Davis School of Veterinary Medicine, and thank you very much.
Thank you very much. Next witness, please.
Thank you, Vice Chair Flora and members of the Assembly Business and Professions Committee for your consideration of AB 2133. As said, I'm Dr. Barbara Filliquist, and I'm a board-certified surgeon and chief of service for the Small Animal Orthopedic Surgery Service at UC Davis School of Veterinary Medicine. My testimony today reflects my opinion on this bill and does not represent UC Davis as a whole. UC Davis officially has no position on this bill presently. In my capacity as a surgeon at UC Davis, I'm responsible for teaching veterinary students how to remove reproductive organs of both female and male animals. These surgical procedures are among the most common ones performed by veterinarians, and all veterinary students undergo extensive training while in veterinary school to be able to safely and competently perform these procedures as a condition of licensure. The training involves education in several subjects that reach far beyond the actual surgical procedures themselves. These subjects include anatomy, physiology, pharmacology, anesthesia, the principles of sterility, hematology, emergency medicine, and others. Neutering a cat is a complex, multi-step surgical procedure. It's not a snip-snip easy task, as some have contended. In fact, surgery represents one of the most advanced aspects of medical practice. To perform it safely and competently, a doctor must possess extensive knowledge, not only to perform the procedure itself, but also be ready and able in an instant to recognize and react when things go wrong. And as despite our best efforts, many things can go wrong in surgery. For instance, in the case of spaying and neutering, body tissues can tear, unexpected anatomic findings can be discovered once the surgery commences, and the patient can physiologically crash under anesthesia. and in some instances, significant internal bleeding can occur. Response to these problems must be immediate and must draw on education in other areas of medicine that I previously mentioned. Registered veterinary technicians, as a component of their licensure, have no training in performing surgery and insufficient training in the peripheral subjects to be able to address any complications that may arise. While we value registered veterinary technicians in practice, and I most certainly know that there's no way that I can do my job the way that I do it without the support and help from registered veterinary technicians.
We appreciate this, doctor. Just ask you to finish up your thought, please.
All right. They're not equipped to be able to perform this surgery. So I respectfully ask you to vote no on this bill, and I'm available to answer any questions. Thank you.
Thank you so much for that. Anyone else in opposition to AB 2133? Name and organization, please. Seeing none, bring back to committee. Any questions from committee members? Seeing none. Mr. Kalra, would you like to close?
Thank you so much, Mr. Chair. Appreciate an aye vote on this measure.
Thank you very much for that. Madam Secretary, please call the roll.
On AB 2133, Kalra, the motion is due pass as amended to the Committee on Appropriations. Berman? Flora?
Aye.
Flora, aye. Alanis? Baines? Baines not voting. Juan Carrillo? Juan Carrillo, aye. Chen? Chen, aye. Dixon? Grayson? Grayson, aye. Irwin? Irwin not voting. Jackson? Jackson, aye. Lowe? Lowe, aye. Lowenthal? Lowenthal, aye. McKinnon? Quinn? Pellerin? Pellerin, aye. Sanchez? Soria? Zipper?
A bill is on call. We'll leave it open for absent members. Thank you. We have one more bill. All right, we're going to start back.